Doctors, welcome. You have what is being called by critics a, quote, radically different approach to managing this pandemic. Instead, you say we should approach COVID-19 with focus, protection, and herd immunity. Can you explain your recommendation and also the science behind it?
Well, it's not radical if you compare it to the various pandemic preparedness plans that had been prepared before 2020, before we had the pandemic. It's in line with that. And the key thing with COVID-19 is that there's more than 1,000-fold difference in mortality risk between the oldest and the youngest. So everybody can get infected, but the risk of mortality or death is very, very different by age. So the point is that we have to do a better job protecting the old among us in nursing homes, people living at home, older people who are about 60 are still in the workforce, while there is no public health reason to keep schools closed from in-person teaching, and young adults should live their lives near normally, because for those groups, the collateral damage done by the lockdowns is much bigger than the risks they face from COVID-19.
Well, and what you just said there, I think, will raise a lot of eyebrows because it is not part of the larger conversation that's happening. In fact, I want to read an excerpt from the Great Barrington Declaration, which you both co-authored. You say, quote, schools and universities should be open for in-person teaching. Extracurricular activities such as sports should be resumed, as you just said. Young, low-risk adults should work normally rather than from home. Restaurants and other businesses should open. Arts, music, sport, and other cultural activities should resume, and people who are more at risk may participate if they wish, while society as a whole enjoys the protection conferred upon the vulnerable by those who have built up herd immunity. Okay, critics say your approach will result in more deaths and is downright dangerous by doing those things. Dr. Anthony Fauci has also called herd immunity total nonsense. So I'd like to get your response to those critics and also your colleagues in the medical community with these recommendations.
So let me address that. So I think that there's a scientific mistake in the way our critics are thinking about herd immunity. There's only two ways at the end point of this epidemic. It's either zero COVID, which at this point is utterly impossible, or herd immunity. So there's no strategy about herd immunity that's unique to us. The current strategy is also a herd immunity strategy in that sense of essentially lockdowns until vaccines. The only question is, how do we get to that endpoint in the safest possible way, with the least amount of death and the least amount of human misery? And the current policy, as Martin said, imposes enormous costs on the non-vulnerable, younger people, and even people under 60, I'd say, without having, who don't have some comorbid conditions. And the problem there is that those costs aren't accounted for in the current policy. We ask older workers to go to work, even face, if they're essential, they go to work and have to face the virus, whereas young people for whom the virus is less dangerous than the lockdown, we say you have to face the cost of the lockdown. Children are a fantastic example of this. Young adults. Among young adults, for instance, in June, 1 in 4 young adults seriously considered suicide in the United States. There's people have stayed home from getting chemotherapy because they're more afraid of COVID than cancer. The harms are absolutely devastating and enormous to people who are less vulnerable. And we have to account for that in our policy. It's immoral to ask them to bear all of the burden, especially young people, to bear all of the burden of this epidemic, which is what the current policy essentially does. While at the same time, we fail to protect the vulnerable. If we followed the focus protection policy, we would have less COVID death and less non-COVID death. It's in a sense, flipped around from what the critics are saying. The current policy is the immoral policy.
So I think the follow-up to that is, it is a fact that this is a deadly global pandemic. So what are the risks in doing what you say rather than what we are seeing with some of these larger lockdowns?
So the current strategy that we've had since the spring has been devastating in terms of the mortality, over 200,000 dead in the United States. And to say, like Dr. Fauci, that herd immunity is nonsense, I mean, that's very shocking because no respectable epidemiologist would make such a claim. So I'm not quite sure where he's getting that from.
Well, let me ask you both. Define herd immunity for people at home. What is herd immunity? What would it look like in 2020?
So herd immunity means that the pandemic will end before everybody is infected. So once a certain number of people are immune, then the pandemic will peter out and there will be an endemic state, so it won't go away completely, but there will be very few deaths and few hospitalizations. So that is a state that's is a good thing when the pandemic ends. And what happens is that a certain proportion of people will have been infected, and a certain proportion will not have been affected. So if we do nothing, that's bad because there will be a lot of old people who are infected and we'll have many mortalities because they are high risk. If we do a strategy where we protect everybody equally, then also eventually a lot of old people will be infected, which is exactly what's happened during this last half year. And that will also lead to higher mortality. On the other hand, if we protect the older people, then there will be more among them who were not infected and fewer who were infected, and that will reduce the number of deaths. So the current strategy with the general age-wide lockdowns have led to many unnecessary deaths. And that's very tragic. And it's unfortunate that there's still people who are propagating for this strategy.
Well, then focus protection and herd immunity, as you say, how many more people would have to die to reach that point?
Well, it depends on the strategy we take. If we continue down this path of age-wide lockdowns, which is essentially the path that Dr. Fauci is recommending, we will have many, many, many more deaths. Because what will happen is the older population will not be protected, as we've seen. We failed to protect people in nursing homes. We failed to protect older workers because we asked them to go, essential workers, to go out into the workforce and face infection risk. We've actually created multi-generational homes where older people are essentially by the lockdowns creating an economic collapse, sending university students home. We created people multi-generational homes that didn't exist before. The current policy will lead to many, many more deaths. It already has. And at the same time, for non-vulnerable people, it'll create deaths that are not from COVID. So it's not a question of exactly how many people will the herd immunity strategy sacrifice. The question is, how many extra people will have to die if we continue down this lockdown strategy? That's the issue. Both will lead to herd immunity. It's not a herd immunity strategy. That's a propaganda term. What will happen is, at the end point of the epidemic, will be herd immunity, whether we continue down this lockdown until vaccine strategy or we adopt a focused protection strategy. Both lead to the same endpoint. The only question is how much human misery and suffering will there be in the meantime? The focused protection idea will reduce the total mortality and the total amount of human suffering among both the older and younger population.
So walk us through focused protection. What would that look like?
So
for the older people, there are 4 groups. One are the nursing homes, and those are the most vulnerable because they are frail. So what's key there is there needs to be frequent testing of all staff unless they are already immune or having had COVID-19. There needs to be testing of all visitors. It's important that nursing home residents can be visited by their family, but if they should be tested, and if they are positive, they should delay the visit by a few weeks. There should be less staff rotation, and of course we should not send any COVID-19 infected people to nursing homes. That was a very tragic strategy that was used in the spring that led to many unnecessary deaths. Secondly, people who are over 60 and in the workforce, either they should work from home or they should be given the financial resources, for example, by taking out Social Security for a temporary sabbatical for maybe 3 to 4 months while the transmission in the community is high to protect them. Those who live at home with some older relative, they should be able to not have to go to supermarkets, so they should have groceries and other things delivered to them. And when they see friends and family, there should be testing available so that they can their family members can be tested before they see them.
In the declaration, you guys say lockdown policies impact the poor disproportionately, and you've touched on this briefly. In fact, Doctor, you are quoted as describing the lockdown as the worst assault on the working class in a half a century, the worst assault since segregation in the Vietnam War. That obviously is a very strong comparison. Why do you feel that way, and how do we best protect people who come from different socioeconomic backgrounds?
So what we have done now is we are protecting very low-risk college students and very low-risk professionals that can work from home, like bankers, lawyers, journalists like you, scientists like us. So low-risk people are protected, while high-risk working-class people who have to go to work to make a living as a cab driver, janitor, working in the supermarket, etc., they are being exposed, forcing to be exposed, and either they die or they build up the herd immunity that will eventually safeguard the rest of us. So in terms of the COVID-19 risk, we are putting the biggest burden on the working class, and especially on the inner city working class, because cities is always the worst place for infectious diseases. So the inner city working class is taking the hardest burden of the COVID-19. At the same time, the lockdown measurements that leads to unemployment and so on is also, of course, affecting the working class the worst, because they have less of a savings or a safety net to carry through in difficult times. So it's a double whammy against the working class.
It is true. There are so many who do not have the option to stay home and not work, and who are losing money as we speak, and losing family members, to be frank. Politics have impacted the debate about how we should be handling this virus. You have been accused of practicing, quote, Trumpian epidemiology. I'd like to get your reaction to that claim.
I don't think there's any such thing as Trumpian epidemiology. There's just epidemiology, and what we're proposing is actually a call to return to traditional public health. Traditional public health involves thinking about people holistically, not just we shouldn't just be thinking about infection control in isolation. We should be thinking about health as a whole. People need more than just to be not sick with COVID. They need to be healthy in many other ways. And focused protection basically calls for a return to that. If that's Trumpian epidemiology, then so be it. But I don't think so. I think what it is traditional public health applied in this extraordinary setting, which will result in better outcomes than the absolutely extraordinary measures we've taken that have proved to be so disastrous.
I don't think I'm going out on a limb. Go ahead.
It's very strange. I'm a native of Sweden. And I have defended the Swedish government's approach to keeping the schools open, and Sweden has a socialist government. So I've defended the socialist government of Sweden, as well as I have defended the Republican governor of South Dakota and Florida, who also wanted to open schools. So I guess depending on where and when, I'm either a raving socialist or a right-wing fanatic, which is sort of kind of rather strange and curious.
Okay, a little bit of both there. Well, so, okay, let's say we send kids back to school. What does that setting look like?
Actually, Martin should speak to this because he knows about the Swedish schools, the experience there. It's very instructive.
So Sweden was the only major Western country who did not close the schools during the height of the pandemic this spring. So all daycare and schools were open for children ages 1 to 15. And there are 1.8 million children in this age group in Sweden, and of these, exactly 0 died from COVID-19 during this time period. There were a few hospitalizations, but so clearly it's safe for children to go to school in person. Also among teachers, they had the same risk as the average of other professions. And old people who lived with children at home did not have higher risk compared to living with working age adults, but without children. So we know also from an Icelandic genetic study that children tend to infect others much less than what adults do. So there's absolutely no public health reason to keep children away from in-person teaching. And if we look at Sweden, the students did not practice social distancing. They did not have masks. What they did was, if a child had symptoms of a cough or a runny nose, they were told to be home and they were sent home. But there was no testing, so whether they had COVID or something else, they were told to stay home. And there was no large school gatherings of hundreds of students. They all were in their own classroom with about 20, 30 students.
So just to be clear here, are you advocating that if kids were to go back on a large scale here in the United States, that they would not, under your recommendations, need to social distance or wear a mask?
I mean, I think it's striking to see that in the European countries that are experiencing a second wave, they're not closing their schools. France is not closing its schools despite a lockdown that's coming. Germany is not. Spain has not. All these places have kept their schools open. Now, some of them differ in the extent of interventions, so that mask requiring and social distancing. But all of them have kept their schools open and found ways to do so, despite rising cases. I think we can differ on exactly the kinds of mechanisms that you would use to implement that, to maybe requiring more social distancing than Sweden did, or in some cases masks when social distancing is not possible. I mean, I think, for instance, for elementary school children, asking them to wear a mask. I mean, how do you teach a first grader to read or pronounce words if they can't see the lips moving? I think you have to be reasonable about what's possible, understanding that the schools are not just an optional thing. It's an absolutely vital human right for children to have access to schooling. Shutting them down from in-person schooling harms them in concrete ways, including lack of access to nutrition. I think almost more than a third of the country actually kids get reduced price meals or free meals at schools. That's where abuse is picked up. Psychologically, it's very important for kids to be in person in schools. So if it requires some measure of social distancing and so on, that's fine. The vital thing is to keep the schools open.
Okay, I do want to move on because I have a few more questions, but I can't move on without at least getting your concrete answer on mask wearing, because it has become a major issue in the United States. There are some who are calling for a national mask mandate. In returning to school and work and sports, as your recommendations suggest, should we be wearing masks moving forward?
The key thing for children is to go back to in-person teaching. So that should be the priority, whether they wear masks or not. One concern with masks is that for older people, if they think that them wearing a mask and other people wearing a mask, that gives safety for them to be out and about in crowded setting, that's very dangerous, because mask is not going to prevent them from getting the disease. They need to be physically distanced from other people and in crowded setting. That's how to protect the older people.
Dr. Bhattacharya, would you like to add to that?
No, I agree with that. I mean, I think the key thing is, we've learned a lot about where the disease spreads and what prevents it. Masks can be a tool that can be used in some settings to do that. And I think there should be clear public health guidance about this. I think one unfortunate thing that's happened around this is the mask issue has become absolutely politicized, so that, and it's something that public health should never do. It should never create a situation where one group looks at the other and says, oh, you don't care about me because you're not wearing a mask. Another group looks at the other and says, oh, you don't value individual autonomy or something. I think we've created this situation, and it's a consequence of very, very poor public health messaging around masks. Early in the epidemic, essentially Dr. Fauci and others told us not to wear masks. And then later they switched on the basis of very unclear, what science they switched it on. I think that is the unfortunate outcome of that, is that mask has become politicized. A mask mandate, I think what would be better is providing good, solid, scientifically based information about when masks work and when they don't work, and trust people to do the right thing and you'll get better outcomes.
I'm curious, you both work at very prestigious institutions. What has been the reaction among your peers with your report and your recommendations at this point in the pandemic?
So among the infectious disease epidemiologists that I have personal contacts with and with I discuss things, not everybody, but the majority agrees with this focused protection approach. Among other scientists who are not infectious disease epidemiologists, I would say it's probably the reverse. Most people believe in lockdowns and contact tracing.
Yeah, and for me, I found some colleagues at Stanford, Professor John Ioannidis, the Nobel Prize winner, Professor Michael Levitt, and others who agree with our approach and agree that this is the right approach. But I'd say that the majority of my colleagues don't agree with it, and they favor something else. At the same time, Stanford and Harvard are not the universe of all scientists. We found from releasing the Great Barrington Declaration that tens of thousands of scientists and doctors from around the world view this approach as the right approach. Which shouldn't be surprising. It's the traditional approach, the approach that existed in many of the pandemic pandemic plans that happened prior to the epidemic.
How do you see a vaccine changing the course of this virus?
Oh, if it was a safe and effective vaccine, it would be transformative. It would help focus protection. So it would make protecting the vulnerable much easier because we could prioritize them for the vaccine, and so that you'd have less of a risk if they should get infected because they would have this vaccine-related immunity rather than having to be exposed to the virus. I think it would be a transformative thing.
And the jury's still out on when a vaccine will be available and how many people will feel comfortable taking it. But what percentage of the population will have to be vaccinated, and for how long before the medical community, doctors like yourselves, and the public as a whole feel that we have the upper hand on this pandemic?
That's unknown.
Yeah, it depends on what the vaccine looks like. If there's a lot of serious adverse events, then we have to think carefully about who's best to get it. If it's incompletely effective, then we have to think carefully about who should get it. A vaccine by itself, in the absence of those kinds of good information. So, like I said, my premise of my earlier statement is that we have a very safe, very effective vaccine. If it's incompletely safe or incompletely effective, then we'll have to. The epidemic will go on. The ideas of focused protection are important with or without a vaccine. They're important now, and they'll be important when a vaccine comes into play.
I know you both have asked your colleagues in the medical community to sign on and join in your recommendations in the Great Barrington Declaration. What is the next step? Because there are many out there in the public who are confused by the differing opinions and the discourse that we do see happening as to the right step forward. What do you see as the solution and the future, in the immediate future, forward in this pandemic?
I think the single most important thing that we need to do is open the schools for in-person teaching, letting the children have the education that they need. That's important for education, it's important for their physical and mental health, and it's important for their social development.
Yeah, I think, and going forward, I think these ideas are not radical. Although some may characterize them that way, they're not radical. They essentially involve allowing people who are not vulnerable to live their lives. That's not a radical statement. That's just a normal statement. They involve moving heaven and earth to protect the vulnerable. Again, not a radical statement. I think over time, and hopefully relatively soon, people will start to move in these directions. I think the states already have moved. Martin mentioned Florida and South Dakota. There are other states that have, other countries, Sweden, of course, that have adopted ideas like this, had them from the very beginning. And I think how sensible these ideas has become already apparent to many decision makers, and will continue to do so. I'm optimistic that if we adopt these ideas, within, within short order, and basically say we will not have another lockdown again. We have a much better outcome with this epidemic. It'll be end quicker with less death and less suffering than if we continue with this lockdown policy that hasn't really produced good results.
And if we don't move forward with the recommendations you both are suggesting, how much worse do you believe it will get?
I mean, you can already see that we've had 220,000 some deaths to date in COVID. Actually, there's been about 320,000 total excess deaths relative to previous years. That's 100,000 extra non-COVID deaths from the lockdown. I think we need to move the strategy because we're harming both people who are vulnerable and non-vulnerable. Getting a direct estimate of that is very difficult. As you've seen also, the forecasting models have not performed very well. So when people give you a forecast and they say, this is a certain number, how many people are going to be infected before you hit the herd immunity threshold, there's a lot of scientific uncertainty around those numbers. Not just statistical uncertainty, but fundamental disagreement among scientists about how many people really you would need to get herd immunity, how many before the disease ends. What isn't uncertain, which is absolutely with complete scientific agreement, is older people and some folks who have chronic conditions are vulnerable, and younger people are much less vulnerable. There are fewer kids that have died of COVID this year than the flu this year. So that's not uncertain. The only question is what the right strategy, what the right thing to do with that information. That age difference in vulnerability is a great weakness of the virus. Adopting this focused protection plan basically takes advantage of that weakness and gets us through this epidemic faster. I think the success of these kinds of ideas will become evident. They already are evident, but will become even more evident over time. And I think the policy will change as a result.
Well, we certainly are in a challenging year, 2020 to say the least, and the Great Barrington Declaration has sparked another conversation in how to get back to normal and save as many lives as possible. So Dr. Bhattacharya and also Dr. Kulldorff, I appreciate your time. I appreciate your insight. Thank you both for talking to us here on News Nation.
Thank you so much.
Thank you.